Well, which one's okay?
Oh, sorry. We could just do it like this.
Is this okay?
Yeah.
Okay. You don't mind that you can't see me?
No.
Okay. All right. I can. All right. And I will mute the speakers on my computer so I don't get feedback, but I will keep on the speaker on the cell phone.
Okay.
Okay. I know this is like kind of crazy.
Yeah,
Can
no
you still
problem.
hear me now?
Yeah.
Okay, good. All right, so I can see you and I can hear you. And I'm sorry I'm delayed. Some of my other patients, as you might imagine, have been very complex this morning, and they give me like 30 minutes for a follow-up, which is not enough time
Yeah.
to kind of discuss all the complexities.
Yeah.
So I'm running a little bit behind. I apologize for that.
Yeah, no problem. I've it all set up, ready to go. I'm just sitting here relaxing.
Good.
So.
All right. So I was kind of reminding myself of, I met you back in January, and we were kind of suggesting this workup to go in these kind of different directions to kind of see what's going on with your kind of symptoms. And we had discussed that some of them were, potentially along the lines of this sort of autoimmune encephalitis, looking into that. And then other ones were potentially along the lines of the kind of autonomic nervous system, which controls things like sort of heart rate, blood pressure, sweating, like tear production, saliva production, how well your gut moves, how well your bladder works, these sorts of things, sounded like that might be a component as well. So, and I know that they've been working diligently at Altoona to try to kind of figure things out as well and kind of see what's going on. I know that there's kind of this strong family history of the autoimmunity. We're just trying to kind of get to the bottom of this.
Yeah.
So we had suggested some additional studies to kind of like try to get some, handle on what's going on. You had the brain MRI, the updated MRI done, which was basically showing like no significant change from the prior one a few years before.
Yeah.
Didn't show anything sort of actively going on. You had the brain PET scan, and this was kind of interesting. So it was saying that, okay, there's a little bit of the decreased uptake of the glucose tracer in the right medial temporal lobe, and that, sometimes this can be seen in someone who has seizures, like in between their seizures. But we have to be interpreting this a little bit with a grain of salt in the sense that, like, the PET scan is not specific. So it's, it is a very good sensitive study, but a lot of things can result in the same appearance on the brain PET scan. So it's not necessarily a very specific study that tells you, like, exactly what's going on.
Yeah.
This is kind of interesting. So maybe some indication that there's an area of the brain that, usually we see is often involved in seizures, like maybe that might be involved. But then I was kind of going back through the records and looking, and I saw that in November you had this kind of prolonged EEG, which was normal, no weird discharges, no seizures from that. So,
I've been having severe memory loss, to the point where I don't know whether it's day or night sometimes. I'm having a hard time understanding what people are saying to me, and I can't retain information. I'm forgetting things that I've known for years, like how to do things on computers, just stuff I knew how to do for years. I completely forgot how to do it.
Yeah.
So, I don't know if that ties in with the insomnia and the inflation, the CNS inflammation, but yeah, I'm sorry. Go ahead.
Yeah. Okay. Well, and another thing, so, all right, so, so kind of taking that, yes. So, and that, you feel like that has gotten worse?
Yeah, yeah. And I started developing a twitch in my left eyelid. It's been doing it, like, every day for the past, like, 3 months now. Almost nonstop.
Okay.
My vision and my hearing, it's pretty much unchanged. It's still really bad, but it hasn't changed much.
Okay.
No thing at all.
So that's your hearing?
Yeah.
Okay. Okay.
My insomnia is very to the point I wake up every single hour. Sometimes if I take my meds, I can get in like 4 hours.
And what meds are you taking for it?
Uh, uh, Lunesta, Remeron, and then the gabapentin was supposed to help with sleep and my burning in my hands, but it's supposed to help me sleep too, I guess.
Okay. Is it helping with the burning in the hands?
Yeah, a little bit.
Okay. And what dose are you on now?
Um, I think 100 milligrams
Okay.
twice a day.
Okay. All right. That's still pretty low dose, so that could potentially go up higher and might be more helpful. Okay. So then kind of looking at other things from the blood work that was done in February, we see that, most of it was unremarkable. One thing that came out that has been within your blood work now and has kind of been consistently in your blood work has been this kind of low serum copper.
Yeah.
And so I wonder, potentially like what to make of that, because copper metabolism, copper processing is, kind of a crucial component of kind of keeping things working in general in the body, but in particular with the nervous system as well.
Yeah.
And so I kind of see that was low. And then we also, when we did the spinal fluid in March, also tested for copper in the spinal fluid, and like none was detected. And usually there is some that is detected, but none was detected. So
Yeah.
I would say kind of looking at the copper levels in the blood and the spinal fluid, that we're kind of seeing that there's low levels in both.
Okay.
And so the implication of this is unclear, but that's why we have been kind of discussing sending you to Dr. Massart in genetics, because to make sure that, kind of look in this further, because sometimes there can be these kind of genetic mutations that can lead to, low copper levels.
Okay.
And so, I know that had been, kind of mentioned as one of the next steps.
Okay.
In terms of kind of trying to figure out, like, why are the copper levels low, and might the low copper levels possibly be, like, kind of contributing to some of these things.
Yeah.
Are you okay with seeing Dr. Massert for it?
No, yeah, definitely.
Okay, all right. Okay.
They also found, let me check this. The thyroid antibodies.
Yeah, the thyroglobulin antibodies is 18, yes. And that was another thing from here. Those are like, those are like not very high. So I did highlight them. So they're a little bit high.
Okay.
I mean, they're elevated. They're there. They're present there, but they're not super high. And those are kind of what we say, kind of non-specific in the sense that, like, kind of like a PET scan. Like, so the thyroid antibodies are like common in the population. I think it's like up to like, and it's very age related. So up to kind of like 30%, I think 30% of women in their like 60s like can have like thyroid antibodies.
Okay.
It's not uncommon for them to be elevated. So it's something to note, and it's something that kind of can go along with this kind of family history of autoimmunity. But I don't, it's not. Sometimes when they're like super high, we see them kind of associated with neurologic problems. But I would say that they're on a kind of lower level.
Okay.
So kind of consistent with autoimmunity, autoimmune tendency, and family history of autoimmune problems. But whether they're kind of directly themselves, playing a role in anything, I think is unclear.
Okay.
Or I would say probably like, I would suspect not. Because they're on the lower level.
When I saw they sent me to the endocrinologist for thyroiditis. My thyroid was inflamed.
Okay.
But I never followed up with that, so
Okay.
I was wondering if maybe you could set me up with one, or
I think
family doctor.
Dr. Cuddy might be able to set you up with one, and I'll too, and I can reach out to her.
Okay. Right.
Yeah, and so the thyroid inflammation, the thyroiditis, is certainly like something that can be autoimmune and often goes along with like one person can have like more than one autoimmune problem.
Yeah.
So that's certainly like something to follow up. So
Yeah.
I will email Dr. Cuddy to try to put in that referral. So endocrine referral through Altoona, because that's probably going to be more helpful for you than doing it through Conceivia or something like that.
Okay.
In terms of your location. All right, so Dr. Cuddy for that, Dr. Massart. And then kind of looking at your spinal fluid, we looked pretty carefully in terms of kind of looking for inflammation. So the white blood cell count was normal from there. The IgG index was normal from there. The beta-2 microglobulin was normal. So all these things that we kind of look for inflammation were normal. In terms of the oligoclonal bands, there were 2 matching bands in the serum and the CSF. So that could basically possibly account for the thyroiditis we see kind of systemically. But not consistent with like a primary inflammatory kind of neurologic process where we often see the bands being much more elevated in the spinal fluid and not matched in the serum.
Okay.
We looked at your cytokine panel as well, and that was normal. We looked at the cytology, which looks, are there any unusual cells there? That looked normal. The protein was elevated in the spinal fluid, the protein of 120. But again, that's kind of this like non-specific thing where alone by itself doesn't kind of like dictate that it can be elevated inflammation for sure, but like all of these other factors and labs that look for inflammation came back very reassuring, kind of against inflammation. So it's kind of hard to say what to make of that sort of elevated protein level. So it's something that we definitely need to kind of make note of, but hard to say exactly what to make of it.
So those proteins being released is that what's attacking my nervous system? Is it affecting how it's affecting my eyes and vision? That is my central nervous system being inflamed, right?
So what I'm saying is that's not necessarily the interpretation I would do, because all the other inflammatory markers are negative.
Okay.
So it's like I don't have a good sense that there's a lot of inflammation going on, like at least in the spinal fluid.
Okay.
And sometimes the protein can be elevated if there's there's tight parts and like narrowed parts of the like spinal column, the vertebrae, kind of like elsewhere. So I'd have to kind of look if there's been kind of like spinal imaging, kind of looking for that. So I would not look at this and say that this is saying that you have inflammation in the spinal fluid, because all the other markers are negative for inflammation. So like I'm not entirely sure why the protein is elevated, but it's kind of isolated in the sense that like other factors are not elevated. So other inflammatory markers are not elevated. So it's kind of hard to know exactly, how to interpret this.
Okay.
A couple of things that I was looking, the autonomic testing has been ordered, but I don't see that it's kind of been done or scheduled.
Okay.
Is there a plan in terms of getting that one done?
I don't think I ever received anything. I don't think I got a call or anything.
Okay.
No. So my vision is it going to be permanently damaged? Is what I'm worrying about. Like, I don't know if I'm ever going to be able to get my ability to sleep back, my vision normalized. I just don't know.
I think what we have to do is, I think it may be related to this low serum copper and low copper in your spinal fluid. So I am not usually kind of like dealing with that in the sense that like I haven't seen this before, and I'm not sure like what's the best way to kind of like replace copper. But I think that what we're looking at may actually be a copper deficiency and not necessarily an inflammatory condition of the nervous system.
Okay.
So like looking at the studies that are done, I'm kind of like seeing these like non-specific markers that like might be talking and might be pointing towards inflammation, but nothing slam dunk. So I wouldn't kind of look at the studies and say that there's indefinitely inflammation of the spinal fluid. So I am worried about this copper copper level that's low and persistently low and consistently low when it's tested.
Okay.
So I am wondering, how much of this might actually be due to like low copper and that affecting kind of like the like optic nerves and things like that.
Okay.
So what what I need to do is kind of read up on how best to like replace the copper. If it's just a matter of like just taking kind of copper supplements by mouth, or like what is the kind of best way to do this? Okay. Do you have a primary care physician?
Yeah.
Because I think we need to kind of get you start taking copper to kind of get those levels up, and then kind of see what happens, if this might actually be due to kind of sort of copper deficiency.
Okay.
Because I'm not really seeing good markers here in terms of inflammation. So I'm wondering how much can be kind of related to the copper. So I think it's important to see Dr. Masser to see if we can figure out like why the copper is low. But I think that we need to start replacing the copper. And so I think that's important. And I will read about the best way to potentially do that, but we might need your primary care physician on board to kind of help us to start kind of coordinating, getting the copper back on board.
Okay.
And then I think I will put in a referral also for neuro-ophthalmology to kind of characterize what is going on with the eyes, and kind of sort of track this over time.
Okay.
And the autonomic testing, I will put in, ask them to kind of get you the information for that, so that you can book that. I think at some point we had gotten you scheduled on the books to see Dr. Gogniat for the neuropsych testing, but I don't see kind of a report from her. So end up happening?
I set it up in Altoona. I have one in Altoona I found here.
Okay.
Yeah.
All right. And the one thing is that Dr. Gogniat sees all of our patients with autoimmune encephalitis. So I was hoping you could get it done through her, because she would then be able to compare the testing results that she's seeing with you and compare it to other patients with autoimmune encephalitis in particular to kind of see if there's similar patterns that she's able to pick it up.
Okay. All right. Yeah.
So would you be kind of open to, doing that with her? I know it would require a trip to Pittsburgh, but I think when it's kind of this complex case where we're not entirely sure what's going on, it probably makes sense to do it with her so that she can compare to what your profile looks like as compared to other patients with autoimmune encephalitis.
Okay, yeah, that makes sense. Yeah, I'll do it.
Yeah, so I will reach out to her. I think right now, unfortunately, she's booking out in like August, but she has been able to get people in through cancellations earlier than that. So I can reach out to her and kind of see if she can get it done through cancellation.
All right, that's no problem.
All right. And so, so we last saw you in January. It sounds like a lot of things are kind of like getting worse. How are things going like all together?
I just I just feel like hell every day. Like, I'm exhausted from the insomnia, the joint pain. Like, I can't go outside because of my visual issue. Like, I can go out, but like I can't do things day to day. I can't remember things. I'm constantly have joint pain. Like, it just non-stop insomnia. I'm exhausted. I mostly just lay here all day. So.
Okay. I'm sorry to hear that.
Yeah. It's.
Okay.
It's insane. It's it started really slow. What's weird is it was progressive. It started with just the night sweats, insomnia, and shortness of breath. Those are my main. I'm very short of breath all the time. And that just progressed to all those other symptoms. It all began with that. And that's when I was working, so I would wake up like 2-3 hours before I was supposed to wake up for work and be like, oh, what's going on? And I'm in puddles of sweat. So, yeah, then it just went from there. It was just like a slow progression.
Yeah.
So.
Which makes me wonder, so this slow progression we can see in sort of like vitamin and mineral deficiencies.
Okay.
But it's not something that goes like very fast. And so, yeah, so kind of looking at all this all together, we have like blips here and there that like might be suggestive of like, autoimmunity, like kind of like systemically, like these thyroid antibodies, but we don't have anything like that's kind of like slam dunk. And when we look at the kind of inflammatory markers for the spinal fluid, they're like, aside from the protein, they're actually very quiet. And so that's why I'm kind of wondering, the extent to this, what role could this potential sort of copper deficiency be playing?
Where it says in my multiple sclerosis profile, the elevated albumin, is how you say it. Down low it says increased blood-brain barrier permeability. Would that tie in anything? Like that it's just there's more proteins being let in or out?
Yeah, that is a possibility.
Like maybe there's a
that
leak?
is a possibility, but that's kind of like, when we look at the kind of, inflammatory markers and just by themselves, it's like nothing is popping up as being kind of positive.
Okay.
So I think, so this is very sort of complex, and we're not getting like direct answers in terms of like, something slam dunk here. But what is concerning is that the copper level is low in the blood. It is low in the spinal fluid. We know that when minerals and vitamins are low, that they can cause problems that can go kind of slowly and then get worse over time, kind of progressively.
Okay.
So I don't know what role that is playing in things. But I think knowing that copper is important for the support of the immune system, among other functions in the body, I think it's important to kind of get that back in the normal level. So what I will do is read up on, how one goes about replacing copper. I think we're going to have to pair with your primary care to kind of like make sure that we get copper back on board, and we're monitoring that, and we're making sure it's getting to like normal levels. Okay. What I know about sort of vitamin and mineral deficiencies is they are slow to kind of develop problems, and then they're slow to recover from problems. So, we may be able to get the copper levels back to normal and back on board, but it may take some time to kind of see like what starts kind of improving with that. So I'm not expecting kind of like fast changes, but I think that's kind of a primary thing that we need to do is start repleting and getting the copper back on board. And so I will read about it kind of in this next week in terms of what's the best way to kind of go about getting the levels up again, because I don't know if you have to do like injections of it or take it IV and do infusions of it, or if it's sufficient to just take it by mouth. So that I need to read about.
Should I try one? Maybe just buy some and try it.
Yeah. So give me a few days in terms of kind of like reading up on kind of the medical sites as to kind of like the best. Because the other thing is like, what's the best way that it's absorbed? Sometimes it's not absorbed so well, like in the stomach. Sometimes it does need to be injected, like for different vitamins and minerals. I'm not saying for copper, so I'm less familiar with copper. But I know when things like B12 are low, that we need to kind of do B12 injections to get the level high. Okay. And I know when things like vitamin D are low, we need to do like super high doses to kind of build it up. So that's what I need to kind of look at. So I think the copper is like definitely one thing. I will reach out to Dr. Cuddy to have her do the endocrine referral through Altoona, so that's closer to you. I will reach out to Dr. Gagne to see if we can get you in for neuropsych testing through her, because she does this kind of autoimmune encephalitis testing, and we'll try to get you in through cancellation. So we'll put you in her schedule, which will probably put you into like September, but we will work hard on getting a cancellation for you.
All right.
So that when it pops up, you'll be like at the top of the cancellation list.
All right. Thank you.
the autonomic testing, which kind of looks into the sweating and some of these other symptoms, I will reach out to my staff so that they get you the information for booking that. As far as I know, I think that's unfortunately only done here in Pittsburgh, which is annoying. But maybe it can be kind of paired together with the neuropsych, possibly in terms of when these things get scheduled. And then given the eye complaints, I think it's probably important to see neuro-ophthalmology. And I don't know that they have anyone out in Altoona. That may be another thing that you may need to go to Pittsburgh
Yeah,
for.
I think I was there one time. Yeah, it's out in Pittsburgh.
Okay, all right. So basically, to like follow up with them. With all the shortness of breath, I wonder if you need kind of pulmonary function studies, which are done by like pulmonary, and maybe like a referral to doing that through Altoona may be possible. Because I think that, I can email Dr. Cuddy about that too.
Okay.
Because I think you're also seeing her next month.
Yeah.
So maybe pulmonary and endocrine through Altoona, and then maybe neuro-ophthalmology, autonomic testing, and neuropsych out here in Pittsburgh. And then I will read up on the copper replacement in terms of like the best way to start doing that. So I think we need to get copper on board, and then we need to get these other assessments. I don't think there's enough here that I would say like, oh yes, there's definitely inflammatory problem in the nervous system, and we need to start kind of like treating that with immunotherapy. Because what if a lot of this or most of this is kind of related to the copper, and we're kind of like, so I am suspicious that the copper is playing a factor here.
Okay.
And I think we need to kind of get it back to normal levels and start seeing how you're doing. So I think that's the primary step number one, while we're doing these other things to assess other things, if that makes sense.
Okay, yeah. You've been very, very thorough. I appreciate it so much.
Yeah, and I know that this is frustrating. I know that we don't have clear answers. I know that, but I think what I'm seeing here from the workup is that we don't have, like, hardcore evidence that there is, inflammation itself in the spinal fluid, which is a good thing. But it's, maybe there is some leakage of this protein into the spinal fluid. But, we don't have good evidence that there's, like, inflammation itself, like, in the brain and the spinal cord. So that is at least, like, a relief. But I think what we need to do is basically, like, get the copper level up and keep working on these other things to see what we see, and then see if anything starts improving with the copper getting back to normal levels.
Okay.
And any improvement that we see might take a long time. But, like, at least we kind of, like, work on getting the copper levels up. If that makes sense.
Yeah.
Yeah, so I would say at this point I wouldn't treat you with like immune therapy, like targeting like inflammation. I think the primary thing we need to do is get this copper level up. Need to see Dr. Massart in terms of like, okay, what testing do we need to do? And, is it like some genetic thing, or like how did this come about, to try to kind of look into that. But so I will email you my kind of like overall plan.
Okay.
But it's going to be basically like I'm going to look into the copper, how best to get it up. So start replacing the copper, get the autonomic testing to look into the sweating and other factors to see if they're, playing a part here. Get the neuropsych testing with Dr. Gagniat, Dr. Massart for looking into the genetic testing for the copper. Get you back in with neuro-ophthalmology, and then endocrine and maybe pulmonary for the pulmonary function test in Altoona. So, like, a lot of things, but I will kind of put it all together in a list for you, so that it helps you kind of, like, stay organized.
Okay.
But I'm worried about these low copper levels, and, I think we need to start replacing those pretty much right away. So give me a few days to kind of look up the best way to do this. And then, we'll start on that pathway while we're kind of doing these other things.
All right.
Does that make sense?
Yeah.
Okay. All right. What questions do you have for me at this point?
Hold on. I have some notes. I was just checking if I have everything
Yeah,
because
yeah.
I can't.
Well,
Yeah, I pretty
if
much
you come
covered
up
everything.
if you come up with things, just kind of be in touch through my UPMC. That'll send a
Okay.
message to me, and within a few days, I'll get back to you.
All right.
Yeah. But the number one thing we're doing now is going to focus on figuring out the best way to get your copper levels up, and then kind of continuing these other things. But I'm not seeing evidence here that's making me say, like, oh, yeah, we need to do a whole bunch of, like, immunotherapy and immune suppression and all these things, because I'm actually wondering, like, what role the copper is playing in all this.
Yeah.
Especially with you telling us it's long, slow progression, that's just, like, slowly, progressively getting worse. I mean, that's kind of consistent with, like, mineral and vitamin deficiencies, like, as a general concept.
Yeah.
So once we get the copper on board, I am hoping that we will see that at least you stop getting new symptoms, and then hopefully some of the symptoms that you have start improving, and then we kind of see what's left over.
All right.
While we're kind of continuing to kind of do these other things, if that makes sense.
Yeah, I got a lot on my plate, man.
I know. And this is like, yeah, and I'm just talking about like more and more testing and what the heck, but like I think that the copper levels being low and seeing that they're low in the blood and the spinal fluid, I think that's giving us a direction to go into.
Yeah. Yeah, that's
So
weird. Having none in the spinal fluid.
What's that?
I said that's weird having
Yeah. So
literally
like,
none.
and especially if there's like this blood-brain barrier breakdown and like the protein is elevated, so we see that like things are getting into there, but like why is there no copper getting in there if there's copper in the bloodstream? So it's just weird.
Wow.
It's weird, for sure. So like, but I wonder, I'm very curious to know how much it can be attributed to potentially the copper, which we don't know until we start replacing it.
Okay.
Yeah. So we'll give me a few days. I'll read up on it. We'll start replacing the copper. And then we'll do these other things, and then hopefully, some things start going in the right direction.
All right.
Okay?
All right, I appreciate it today so much, ma'am.
Oh, no problem. Let me ask you to just do a few things for me on video, just some basic stuff. It's like, we can't do much on the video, but, like, just when I see a few things. Can you, with just your eyeballs, can you look up for me? Good. Can you look up? Can you look down? Can you look left? Can you look right? Good. Can you give me a big smile? Show me your teeth. Good. Can you stick your tongue out at me? Good. All right. And if you take your hand and kind of touch one side of your face and the other side of your face, does it feel the same?
I have less feeling on the left side of my face.
When you touch with your hand?
Yeah. You see how my face is like kind of swollen on this side?
Yeah. I see like the changes in the eyes. Yeah.
Yeah, it's there. I'm getting sent to the ENT to figure out like there's some kind of when I talk I get pulsative tinnitus. Maybe that's something that has to do with the blood-brain barrier leakage. I don't know if it's like it's. I've had really bad sinus issues, and pulsative tinnitus. But yes, my left side I have less feeling.
Okay. All right. Well, it sounds like another thing on your list, unfortunately.
Yeah.
I think something to look into. If you kind of rub your fingers together so they make kind of like a wispy sound, can you listen on both sides and see if it sounds different? You can do it just with one hand, like if you just kind of like rub your thumb and your index finger and your middle finger together. Does that sound different on one side than the other?
No.
All right. So hearing is equal. Okay. And then if you take a hand and basically rub one arm and the other arm, does it feel the same on both sides?
Less on the left side. It's like that in my leg, my entire left side.
Leg too?
Yeah.
Okay. All right. And then if you just kind of take your finger, your index finger, and then go back and forth between your nose and the screen, so just a few times, just kind of like take your finger back and forth and go between, basically touch your nose and then touch the screen, and then touch your nose and then touch the screen. back and forth in front of the camera.
Yeah.
Okay. All right, good. Okay. All right. So I will kind of send you a list of the things we talked about. I know it's like 10,000 things.
Yeah.
I am hoping that once we start kind of replacing the copper, that at least some of these things start improving.
Yeah, I'm not gonna stop. I'm not gonna give up.
What will improve and to what extent, I'm not sure.
Yeah.
But I am hoping that things starting to improve, and then we kind of like see, are there leftover symptoms, or like is there kind of like the way that things are kind of slowly been getting worse? Do they like reverse and slowly start getting better? I mean, that's what I'm hoping for. And just give me a few days to read up on the copper so I can then figure out the best way to start replacing it.
Okay.
Because, for instance, say it's like best to get like injections or infusions or something like that.
Yeah.
If you just start taking it by mouth, you might just like waste your money on like buying it over the counter or something like that, and then it like doesn't even absorb properly or something.
All right.
So give me a few days, because I don't want to kind of say like, oh yeah, go and buy it and try it by mouth, and then it like doesn't do anything.
Mhm.
So, all right. Reach out to me if you have questions. I will kind of summarize the things we chatted about and kind of put things in order so that we can start getting this stuff arranged for you, okay?
All right.
Okay, nice to see you. I'm sorry to hear it's been so miserable. I'm glad that you were able to get some of these studies done. I think they were helpful, and then we just kind of like start replacing the copper and go from there.
Yeah, I appreciate the attentiveness and,
No problem. No problem at all. Okay, all right, so have a good rest of your day. I will read up on the copper, and we'll go from there.
All right, thank you so much.
You're welcome. Take care.
Yeah, you too.
Just drop the phone. But take care.
Thanks.
And then we'll make a follow-up appointment probably in about like 2 months' time, 2 to 3 months' time. So we're kind of like following up on this. I know that you're seeing Dr. Cuddy next month, so I will be in touch with her too.
Okay.
All right.
All right, thank you so much.
You're welcome. Take care. Have a good rest of your day.
Thanks. Bye. You too.
Bye.